Guests who will be helping us understand where we are, where we ought to be, and what can be done to improve access and use of some of these contraceptives. But before I introduce them, let me just go through our preamble. The World Contraception Day was launched in 2007 as a global campaign to raise awareness about contraception and to empower young people to make informed decisions about their reproductive health. Since then, that day has been marked on the 26th of September. Uganda faces a stark reality that mirrors many countries in sub-Saharan Africa. Nearly 1 in 4 girls aged 15 to 19 are either pregnant or already mothers, and that justifies the need for contraceptives across the board. Lynda Birungi is a service provider at Reproductive Health Uganda. She is joining us this morning. Welcome to the program.
Thank you so much.
We're also joined by Dr. Ssennyonjo, the in-charge RHU Katego Clinic. Many thanks.
Thank you.
Let me begin with a look at the thinking behind World Contraception Day before we delve into the state of affairs with regard to how young girls and women are accessing these much needed services or tools to be able to counter one of the underpinning problems when it comes to population growth. But let me begin with Lynda Birungi. As a service provider, I think the commemoration comes in very handy and timely. Do you mind taking us through how the RHU office in Uganda views or conceptualizes this Contraception Day? That's a word that has given me a little bit of trouble today. All right, let's get on with it.
Thank you so much. As Reproductive Health Uganda, our main focus one is, of course, giving information and educating people on these contraceptives, and of course giving the services, them accessing them, getting the quality services, affordable and easily accessible as RHU. So how RHU views this: one, we want the communities, the population to get more information. A lot of myths and misconceptions are out there, and our intention is to make sure we give as much information as we can, as to start with, even before giving the services. But of course, giving the services is core. Yes.
All right, Dr. Ssennyonjo, you are the in-charge at Reproductive Health Uganda Katego Clinic. Katego Clinic, I think, sits at the very headquarters of the organization.
Yes.
What is the state of affairs when it comes to contraception use, something that ought to be, or rather something we ought to pay attention to that stands out? You can highlight some of that.
Okay, thank you very much, moderator. And good morning to our viewers. Starting from the look of things from the national perspective, I will make reference to the Uganda Demographic and Health Survey 2022, which was released by the Ministry of Health. Look at the teenage pregnancy rate. We look at the need for family planning, the unmet need for family planning, and the contraceptive prevalence rate. Okay. Yeah, so when you look at the statistics that were raised in Uganda currently, the demand, total demand for family planning stands at 66%. That means 66% of the population that was sampled, aged between 19 to 49, actually the total need for family planning stands at 66. And of this, 24% is unmet need. This means that these are the people who actually would benefit from using family planning. They need it, but they can't access it from anywhere. Okay, so this is the unmet need that we have. And when you look at the percentage of young people who conceive, you've given the statistics of
Sub-Saharan Africa.
Sub-Saharan Africa, yes.
Yes, pretty much Uganda is in there.
So young people actually conceiving around, if I'm getting the figures correct, around 20% to 40%, around there. I would cross-check the figures. Of young people between 15 to 19 are actually either pregnant or mothers by the time the survey was released. Okay? So this shows that there is actually a very big gap that's still existing in regards to addressing teenage pregnancy, but as well as using contraceptives or family planning. Unfortunately, there's a lot of biases when it comes to using family planning, especially among the young people, that we need to rebuke. Okay? But I feel there's a lot that needs to be done, that has not been done, in as far as addressing teenage pregnancy is concerned, and as far as meeting the need for family planning is concerned. Yes.
All right, that's a very staggering statistic when you look at the numbers. When you say they are either pregnant or already mothers, I think there is a need to acknowledge that there are attendant effects, including unsafe abortion.
True.
We have aspects like maternal death that is occasioned upon some of these young ones, mental illness, malnutrition. It all presents a whole set of new challenges. I think as a service provider, you do encounter these scenarios more, you know, on a, I don't want to say on a daily basis, but frequently.
True.
How do you deal with, first and foremost, the fact that somebody either didn't use the contraceptives or used them the wrong way, and then they are also grappling with unsafe abortion, mental illness, or mental health challenges, as well as malnutrition?
Of course, it's a very, very big challenge among the young people. And as a service provider, sometimes it gets overwhelming seeing these young girls. They are stuck, they don't know what to do, and you know, they are still children. Either they have babies or they are pregnant, or they have complications following unsafe abortion, and sometimes maybe at home things are not very good. So especially in the communities, and sometimes we think that the problem is actually in the rural areas, but even in the urban areas, situation is not good at all. So usually, talking to these young girls, first of all, is very important, encouraging them not to continue with this, and even to pass on information through universities, communities. We have youth corners at all our branches where young people are actually equipped with information to continue giving it to their young ones. So, but most important, encouraging them to seek rightful information. Like Dr. said, there is a lot of misunderstanding of some of these things and bias, but most important, seeking rightful information from the right sources, from the right people, but also seeking the services. And we as service providers provide what is in our means without judging them. Yes.
All right, that is in line when you speak about the need for information in order to make informed choices. That falls very well within line of this year's theme, which is the power of options, empowering choice, enhancing health. I do not know whether there is a sufficient collaboration across board, the multi-sector approach, where government comes in, you, the civil, the sector players, the power of options when these young girls and women have this information with them. Have you, for example, noticed that the change in behavior is sufficient for other players to ensure that the flow of information is consistent and constant, but most importantly, the provision of services and products is also timely, especially for rural dwellers, as Madam Lynda Birungi alludes to?
I have to say there's a lot of success. Much as I say there is still need, but still we have to acknowledge that there's a lot of success that has been attained through a number of programs that have been carried out across the country, across board, both in urban and the rural settings. We have a number of programs that are addressing young people in the different parts of Uganda. We do empower them through the information provision, like Lynda has said. We do carry out service delivery, providing these services. We do have community structures that we are engaging to make sure that they can reach out to the young people deep down where they are, okay? We've established structures among themselves as the young people. We have what we call the Youth Action Movement. It is the young people reaching out to themselves. Of course, empowered young people reaching out to themselves, reaching out to their peers, reaching out to their colleagues, to make sure that they provide the actual information that they're supposed to provide. And this has actually resulted into a number of behavior changes. There is positive change when it comes to seeking for services from young people, from all ages. And also we've seen multi-sectorial collaboration. We have what we call the SRHR Alliance, where a number of organizations that are working in addressing these concerns come together and work together. We've also had partnerships with a number of cultural leaders across board here in Uganda, in Chigezi, in Kabalole. Recently, our team was in Kabalole, if I remember, Fort Poto, trying to make sure that we spread this gospel, trying to make sure that the different leaders come on board to also be part and responsible for, addressing these concerns or addressing these challenges, especially concerning around teenage pregnancy and other. Of course, you talked about unsafe abortion. Those are the results of not using contraception, family planning.
Results of not using contraception, family planning methods. That brings me back to the service provider. The range of contraceptives that are available on the market also poses another threat, or confuses many of the young people which contraceptive to use, when and how. That is down maybe to a lack of information, and when this information is provided, then they can make the right choices. But are contraceptives safe? And then as you answer that, there's also a mindset aspect where there are people or elements who think if you expose the young girls and women to more information about contraceptives, you're telling them that you can engage more in, for example, sex. After all, you have the options available for you to deter the effects of sex.
Thank you very much. To start with the options, yes, the range of options are there. Usually we give you all the options, put everything on table, and of course you make an informed decision of what you feel you want to use. Doesn't matter what age, for as long as you're within that childbearing age. By the time a young person comes to seek a contraceptive or to seek information, one, I want to credit that young person, because he has come or she has come to seek information and to seek a service so that we avoid complications that can come after of not using family planning or contraceptives. But also the mindset of if we give them information, if we make the services available to their disposal, we are encouraging them to go behave otherwise. I want to disagree. If we do not give them this information, I feel it might even make the situation worse. When they come to seek information, it's not a must that you're actually going to take the contraceptives. But some of them have a lot of myths and misconceptions from their peers that they do not have first-hand information. So when they come, you give them information, guide them. They make what we said, informed decision. They may choose to take them, they may choose not to take them. But on the other hand, doctor said we have the highest number of pregnancies in teenagers, and children are dropping out of school. They are stopping, their careers are getting stagnant because they are lacking information, because they don't have access to this information, to these services. So what are we doing? Not to give them information and we let the country go down because the new generation cannot. We fear to tell them these things because we are scared of what might come after. In my view, what will come after might even be worse than what we are trying to prevent. I'll just give you an example. If a young person does not take a contraceptive and chooses, by coincidence, conceives and chooses to do unsafe abortion, the complications and the expenditures attached to that one particular person, even with the government, is more expensive than taking a simple contraceptive. In other words, just to go back to what you asked, are they safe? Contraceptives are very safe for as long as you seek the service from a trained, healthy provider to help you make a choice that is appropriate.
Okay.
Yes.
And how, if I don't know across the country, whether you as private actors, not necessarily under the dichotomy of government, do you, for example, attach yourselves to government facilities? For example, are you in Butaleja as RHU?
Yes.
Sure?
Yeah. We're actually there. You see, during our program implementation, we do not work as RHU. We partner with a number of facilities, both private and public. So as we go out to reach out to the people, we actually make sure that we partner with these public facilities because they have a high volume of clients who come in, especially our target population, the young people whom we want to help through our programs. So make sure that we work with them. And in Butaleja, yes, we have a project that is working, it is based in Toro as our branch, but it is working covering across that entire region. So even in Butaleja, we are actually operating there.
Okay. And when I look at the National Family Planning Cost Implementation Plan for 2021, 2022, and 2024, 2025, overall funding need for family planning commodity services, for example, in the United States alone, is $332 million. What are Uganda's investment options when it comes to this particular? Do we have a cost plan that, for example, if we had all the money available to us as a country, we would achieve optimal levels of awareness among the young people about contraceptions and maybe be able to avert the dire consequences that come with inability to achieve or rather access these services and products? That question goes to any one of you.
Doctor can take it.
Okay, thank you very much. Now, we have to acknowledge the government. The government has been very proactive in addressing this, and a number of policies have been worked on. They have been passed, and guidelines have been offered. They have been issued out to private sectors, to civil society organizations, and to the government itself, because there's also an arm in government that is supposed to directly participate or take lead in this. So a number of these are actually available, and the priorities have been set, okay, in addressing this. However, the challenge, like you said, is still around funding, okay? And that's where civil society organizations come in to make sure that they help the government, or they work hand in hand with the government to address this. But also there's more need for support from government still for these civil society organizations, okay? Because we are doing a lot of work, but sometimes you find that you're doing the work, but the support that is coming through from government might be a little bit of limited, okay? So it depends so much on external funding, and when the funding that from outside the country goes down, most of these civil society organizations are actually compromised, or they're going to a state whereby they can't address all the priorities that we set. Okay, so every year we have targets that we want to achieve as organizations, as the government, but the challenge comes with the funding that comes through. And I think moving forward, we need to have sustainable plans or strategic plans, whereby with or without external funding, we are able as a country to still work and address the gaps. Otherwise, if we just keep relying on the funding that is coming from outside, what will happen in case they stop? Because
the taps have closed ever since the COVID-19 pandemic was occasioned upon us, and it's perfectly understandable when one person says, I think I should try to limit how much I put out, especially if it doesn't bring the desired results. Now, the political question is, President Yoweri Kaguta Museveni has often talked about the need for us to widen the market. A greater population is a big market for products and the ability to make money. And then there is the message, the gospel of family planning. I don't know, I don't want to put you in a position where you're on the spot on anything fiscal or fiscal policy. But how does Africa navigate this seemingly very tricky situation. The need for a population that ought to spur development, but at the same time as a continent grappling with aspects of public health. I do not know whether it's a question that ever lingers on the platforms and your PowerPoint presentations in boardrooms as service providers within this particular sector. Is it something that you ask yourselves, or have you advised government on that?
Oh yeah, we think about this, and Mr. Moderator, I have to also pose a question that as we want to have this population growth, okay, and we say it is going to help us maybe achieve the development, move into the another income state from the lower income,
middle income.
The question is, the person you're telling to produce more and more children, are they able to take care of them? That's why we are seeing there's a lot of unemployment, there's a lot of school dropouts. People are in the villages, they're making babies, which is good, because we need the population growth and all that. But what is the socioeconomic status of these families? What is the socioeconomic status of these children that are being produced? Which schools are they attending? And I mean, are their needs being met? The health needs, the educational needs,
that's right.
The financial bit of it, okay? Are they being met? I think you see developed countries where their populations are very high. For example, talk about countries like India, okay? Because they have a high number of people anyway. But look at their standards of living. Look at the investment by their governments into the population, into health, into education, okay? These countries have actually prepared themselves for this population growth. But are we ready for that? Or we just want to have many children and then we have more of them lack jobs and then go into theft and other, those illegal activities, okay? So I think population growth is not something that is bad, it's something that we actually need. However, we need to have planned growth, not just telling people that you go, and I want to be very clear on this, I'm not against the president's word.
No, not at all, not at all. Yes. I was very clear. I know it's a bit controversial, but this is advice and information that policymakers need to pay attention.
So we need to have planned growth of the population. So if we want our population to grow, let's plan for it.
Okay.
Yes, as policymakers, as government, as implementers, let's plan for it. And it is very okay. And by the way, contraception, we are discussing contraception, but the bigger picture is family planning. So if someone can afford having 10 children and they can look after them, that is okay. That is very, very okay. The overall point is plan for them, make sure that as you bring them in this world, you plan for them to have
take care of
the best.
Exactly.
Okay. Wow, that's a very good message, no doubt. And I think that's where the whole aspect of planned kids and planned people comes from. All right, now let me go into the World Contraception Day proper. What is going to happen today or later today? What is going to roll out? Is it a national celebration, commemoration? Take me through what's going to happen.
Yes, of course, it's a national celebration day for Contraceptive Day, and at different levels, in different districts, with different partners, they are celebrating it in a special way, in a different way, according to what their means allow. And I think...
Where do we have the big event?
In Uganda, we have in Butambala
district.
Yes.
And services started a few days earlier, like with outreaches and so on. But the official day is today. The official celebration is today is at Gombe Football Field. Yes.
Gombe Football Field.
Yes.
All right. The reason I wanted to know the detail of the big event is what informed Butambala. The statistics there, a little bit appalling more than any other place. Why is the big day in Butambala and not Butaleja?
I think usually, different contraceptive days are celebrated in different... Last year they celebrated it in Kabalole, if I remember right, in Fort Potro. So I think different districts are given opportunities.
Okay.
It's not.
It's a rotational thing.
It's a rotational thing. It's not even. I think it's not about what takes the biggest. Otherwise, we would be going to Butaleja, where we have very many young children getting pregnant every year and so on. I think it's not about, but rotational. That's how I think. I don't know what doctor has to say.
I hope you understand why I'm insisting on Butaleja, because I know
we understand,
there.
yes,
I know
we
the situation
understand.
on the ground. Just the other day we had a 14-year-old Pop 4. And it was a bit challenging because the gentleman responsible for that
he's also young.
Very young. And it's really sometimes disturbing, but that is the reality on the ground. I do hope those interventions can drive more into that part of the country so that we can address what is no doubt a very, very long-standing problem. Okay, I think that will do it for the interview. Any last words from each one of us? Let's begin with the doctor.
Thank you very much. So as we conclude our program today, I want to emphasize the point that moving forward, we need to provide the correct information that needs to be corrected. So I think as policymakers, as government, as implementers, as all stakeholders, one, we need to make sure that we emphasize the point of sex education, or sexuality education comprehensively, provide the right information, debunk the myths around contraception, destigmatize conversations around contraception, okay, and then have multi-sectorial or multi-stakeholder engagement and participation to make sure that we all come together to address the issue of teenage pregnancies, like you've said in Butaleja and across the country. And what I can say lastly is, as RHU, we are always available to provide this information and to provide the services.
All right. Ideally, you would have spoken last, but I want Lynda Birungi, who is a service provider, to speak in a language, especially to the young girls out there, one that they are comfortable with, the ones they understand, they won't have to fear to come forth to seek information.
Yes. I just want to encourage young people, please access these services to your nearest health facilities. As for RHU, by the way, we have variety of, we have many branches. In the east, we have Uganda, we have Mbale, we have Kapchora and Tororo. In the north, we have Apache, Lira, and Arua, and Gulu. Then in the central here, we have Katego, of course, in Kampala, we have Bwaise, we have Michiana, we have Lowero. Then we also have in the west, Mbarara, Fort Potro, Hoima, and Bushen. Why am I mentioning this? All these services, at least we try and see that every region is represented to a certain level. Sometimes it would be bigger than that, but it may not be possible. But I just want to encourage young people, please access services from the right sources. Access the information from the right sources. Like we said, we have in all these facilities, our RHU clinics I have mentioned, we have youth corners where there are young people that have been equipped with very good information, peers they can talk to. And then too, our service providers know what they do. That's one thing I will assure you. Okay. But even the public health facilities, all these services are there. I'm just encouraging the young people to please go and access these services, access the rightful information. Even if you read something and it's not very clear, you don't understand, seek from a person with first-hand information. All right, yes.
Thank you very much. Lynda Birungi, her service provider with the Reproductive Health Uganda, as well as Dr. Roger Ssennyonjo, the in-charge at Katego Clinic. For those of you out there who might be grappling with a lack of information and the courage to go out there and seek this information, we are urging you to step up so that you can make better decisions and also guarantee yourselves a bright and sustainable future. It's all about the future. Do not disorganize anything. You still have a lot of time to be able to be productive, not only to the country, but your family and of course yourself as an individual. That will do it. But when we return,